This is Shannon Holton, Real Salty Dietitian and owner of Sound Growth Nutrition and Wellness. First thing I wanted to do today is to share that with the summer months upon us, I will be doing one video per week. That way everybody has lots of time to spend with their families and going on vacations and all the things and the busy stuff that summer brings with it. So what I wanted to talk about today was a series of webinars that I attended on obesity medications. And it really followed a path looking at kind of historically and chronologically some of the different types of medications. It isn't all related to the GLP-1s, but also how nutrition professionals are incorporated into discussions about obesity medications because a doctor is prescribing it. So the middleman ends up being sometimes the dietitian, and that's one of the frustrations that I wanted to mention and talk about. So the discussion really centered around how the different medications work in the body and why different ones are more advantageous for different populations of people with different medical histories, people with different behavioral health, diagnosis and histories, and where we screen and make those decisions. And again, this was geared towards nutrition professionals. So this was geared towards dietitians being a part of that shared decision making, which we know based on the number of prescriptions being written for this, that not every prescription written for an obesity medication has a dietitian associated with it. There are some insurance companies now that are incorporating a wellness program into their plan. It's a little bit more cost effective than just going straight to paying for a $1,200 a month medication. But it can also come across as a gatekeeper or a barrier to what a client or a patient thinks that they really want, which is those medications, because they're miracle drugs, right? But what it ends up doing is putting some of the negativity on or associated with seeing a dietitian. And what I mean by that is that if you have to check all these boxes to get to the end goal that you think that you want, which is the medication, then you look at the dietitian as a barrier or a gatekeeper or a box to check, rather than somebody that can actually make an impact and make a difference in your wellness journey. What it ends up doing is creating that, again, negative connotation with the dietitian because it's a hoop. It also creates some thoughts, and it may not even be conscious thoughts, but I think about it from my own perspective. If I were somebody who has struggled with weight my whole life, which I've talked about before, and I am, and I know that I have done all these things. I have done exercise plans. I have followed really regimented and strict diets. I have tried different types of lifestyle modifications and diets, and I'm still struggling with getting that last 20 pounds off. Going through all those hoops makes you feel like you have to fail before you can succeed or get to the treatment that you need. What I really like is if we could change the narrative and really incorporate dietitians from the beginning as a partner in shared decision making. And shared decision making is kind of like one of those buzzwords of healthcare, and talking about, sitting down with a patient and really going through their options and saying, this is what you think you want. This is what I want. Now let's talk about it and determine what's best for you and do it together so that you feel like you're owning your healthcare and the doctor feels like they are being able to communicate their expertise and knowledge in an area. Now, doctors, I don't know if anybody's been lately, but they're busy. They have tons and tons of back-to-back clients. Sometimes they're double or triple booked because of their reimbursement rates and all the things that they have to do to meet their regulations and guidelines. And so oftentimes you can go into an appointment and you don't get the time to really sit down and have those discussions. And dietitians are a really good person to have as a middleman in some of those shared decision-making aspects, because they can sit down with a client for an hour visit and really explain physiology and nutrition and really explain the different options and how they work and what might work best for them. So that level of frustration gets me every time, because now you have a dietitian that is plopped into the middle of this decision, but it isn't really a decision. I do think that it's important to have us involved. I don't want to take us out of the equation, But I think that a dietitian discussion needs to be brought in from the beginning. As soon as the patient comes into an office and says, you know what, I really want to get this weight off. I've heard really good things about this medicine. What do you think? And instead of the doctor just writing a prescription or saying, oh, this is what your insurance says you have to do to get to that, you have somebody that can be a part of it and not be kind of demonized or vilified that we are a barrier or a roadblock or a gatekeeper, so to speak. Again, having the dietitian involved from the beginning of that decision-making process can help to create the most positive and impactful outcomes for the patient. What I will say is that this is it can be somewhat political in the sense that we have to kind of really push for insurances to have coverage for us. And so then that creates another barrier. Most insurances will have limits or outline guidelines for what different plans will cover. And again, even if I have a Blue Cross policy and somebody else has a Blue Cross policy, mine might look different than theirs because it all depends on the contract and the negotiations that you have with your employer or your provider that is giving you or issuing you those policies. So just because you have Blue Cross, I might get it covered, but the person over here may not get it covered. And so what happens is that if you can get through these hoops and check all the boxes, oftentimes an insurance will end up covering those medications. But in those intermediate steps, in those boxes to check, is it covering what needs to be done to check all those boxes? And those can be perceived as barriers. And again, if the dietitian's the limiting factor, it becomes a negative connotation with nutrition and dietitians because, well, you have to get through a dietitian, but we're not going to pay for it. Largely, a dietitian is way cheaper than the $1,200 a month prescription. But if the insurance will cover the prescription in the end for a copay of $25 or $50 a month, it's still cheaper than a dietitian visit. And so it becomes a barrier. And I really think that that's one of the biggest frustrations in my profession is that it seems to be there are lots of barriers related to access to a nutrition professional. A soapbox I've talked about many times before. But I did want to just say that my discussion today is largely just me kind of rambling about my frustrations related to where we fit into the healthcare system. And the soapbox I stand on is always that dietitians should begin in primary care and provide that partnership with patients for shared decision making. I hope that everybody has a great week and a great weekend, and we'll see you next week.